goosebumps right now. I'm just thinking of your child. At one point, you want to see him over as a soldier.
That a disease called avascular necrosis.
Very young generation also,
Yes.
even if you're active.
The commonest reason is steroid intake.
How do you get to know?
Do not have any identifiable cause.
2-3 days with heavy doses.
You look good, but you don't feel good about yourself.
Namaste and welcome back. Thank you for joining in, everyone. First of all, this is another episode of our podcast, and today we have another expert here with us. Ladies and gentlemen, he's a personality who already is inciting, who is sharing his knowledge and his expertise with a lot of people out there on social media, be it YouTube, be it Instagram, and today we are thankful that he's here with us to share his expertise. We have Dr. Pankaj Walecha, an orthopedic surgeon and also an expertise in hip and knee surgeries. First of all, hi sir, how are you?
Hi, thank you. I'm good. Thank you for having me.
So when I got to know that you're an expertise in hip and knee surgeries, something I wanted to learn about that in general life we do discuss about knee problems. We do discuss about, which is very common, even in our generation. Particularly this sedentary lifestyle. आजकल उठते बैठते बोलते हैं अरे गोडों में दर्द हो रहा है. अरे very young generation also.
Yes.
Even if you're active.
Yes.
We do not discuss a lot. We do not have conversations about hip problems and hip joints, and you have a lot of expertise over decades of treating those. What are different problems and what kind of patients, what are the conversations that you have when you are treating anybody?
Well, first of all, thanks for having me. It's going to be probably a very interesting discussion, because in India we are a country where we see a lot of knee patients, as you rightly mentioned, and in different age groups. Also people between 20 to 30 and people from 60 to 70, they have knee issues. But hip issue is something which probably surfaced during the COVID time.
Okay.
So as a hip and knee specialist, we not only see patients with knee osteoarthritis or sports injuries of knee, but I commonly see a lot of patients coming with hip pain, and that too in young age group.
Okay.
So let's say between 20 to 50 years of age group. And at that age, you are like very, very active and you want to do all kind of adventurous activities, and you are part of active teams. You have to travel and do multiple activities through the day. But yeah, I think it is very, very important to bring up that a disease called avascular necrosis is probably the most common disease I see in my clinics.
Okay.
And a lot of youngsters are not aware of it. And there is a need to make people aware so that it can be picked up early.
Yes. You just mentioned this particular term, which is
Avascular necrosis.
Necrosis.
Correct.
Okay. Let's throw a little light on that. What exactly, for a person sitting with an expert, you would have a lot of deep knowledge about it. But a person who's hearing it for the first time?
Yes, I understand. So let me simplify it for you. Avascular means a part of the body where there's no blood flow.
Okay.
And necrosis literally means death.
Okay.
So if we say avascular necrosis of femur head, which is part of the hip joint. So hip joint is a ball and socket joint.
Okay.
And ball is the femur head and socket is the acetabulum, just to put names to these structures. And when the blood flow to the femur head is blocked, due to various reasons it can happen, that's what we call avascular necrosis. Because of the blockage of the blood flow, the bone becomes dead.
Okay.
So it's something which a lot of people don't know about, and I have had patients who have been diagnosed with AVN, and they would come to me and tell me, "Doc, we didn't know what is AVN, I just knew ABC. I didn't know what is AVN, how it has affected my life so badly." So literally it is blockage of the blood flow to the bone leading to death of the bone. And there can be many reasons for it, many causes for it. And if I name a few, then the commonest reason is steroid intake.
Okay.
So we have seen steroid intake which was being used as a treatment for COVID patients. And we have seen a lot of COVID patients coming with AVN to us.
Okay.
Also, gym goers who are kind of into bodybuilding, they also end up having steroids in some form or the other if they are not well informed.
Okay.
And that can also lead to avascular necrosis. You look good, but you don't feel good about yourself.
Okay.
And then other cause could be excessive alcohol. And people who are into a lot of alcohol intake on daily basis, not all of them, but many of them have avascular necrosis. And a majority of the people are such, they come and ask me, and this is the commonest question people ask me, which we also struggle to answer. There are a certain subset of patients who do not have any identifiable cause.
Okay.
And that is labeled as idiopathic.
Idiopathic.
Idiopathic. In literature also it's said that we don't know what is the cause.
Okay.
Now these are the people who are like in a kind of mental trauma. Because people who have had alcohol, people who took steroids for some reason or the other, they know, okay, this is the cause.
Yeah.
But somebody who has done nothing of that sort and still ends up with AVN, they struggle and they have to really go through a very tough time to accept that I have AVN. And it is a disease which needs treatment and which could be surgical also. So in briefly, this was, there's so much more about avascular necrosis. But this is in particular the most important highlighting points which we would like people to know through this podcast or through this conversation, so that they have a high index of suspicion when they have symptoms which could be pointing towards AVN.
Okay. Now, I want to also understand another point, that how do you get to know that this is happening to you? But before that, while you were answering this last question, I want to also understand when you mentioned that if somebody is going to gym or bodybuilding, and which is another reason a person is doing it to be healthy, then there's a lot of trend of going to parties and people are having alcohol, which is another increasing number. And then if somebody is taking steroids, is it only for gymming, bodybuilding, or we also see nowadays that steroids are also used for a lot of other reasons. Are these very common causes of AVN?
Okay, so let me pick it one by one, and let's go to gym goers or fitness first. There are a lot of people, including me, we go to the gym, we do fitness, and we all want to stay healthy. So it's not about those people. Like, going to gym is very healthy and we should continue to do that. But there are people who are into bodybuilding competitions, or people who are like very crazy about their physique, and they want to beef up and they want to make muscle, and not all of them are very well informed about what they are consuming. I see a lot of parents of 17, 18-year-olds coming to me with a concern that my son is having a particular supplement. We don't know whether it is safe or not.
Okay.
So few of the supplements are good because they are US FDA approved and we know what composition they have. But on the other hand, there's a lot of stuff out there which is not really approved and which we don't know much about. And these combinations of multiple things could have steroid in it. Or sometimes I would rather say that I have had patients who have told me that before the competition, I was told to have steroids for a few days.
Okay.
And that too in heavy doses. So when heavy doses of steroids are taken, that too in a very short span of time, that can also trigger avascular necrosis.
Okay.
And avascular necrosis, unfortunately, is a progressive disease, especially if the reason which led to AVN continues. Let's say I'm a bodybuilder, I went for a competition, I took steroids and then I stopped it. And then I have another competition, again I felt, oh, I was like doing good in the last competition, so let me have it again. So that ends up becoming a habit sometimes.
Yes.
And then although you look good, but then your joints are being damaged, you don't feel good. And steroids have effects, negative effects on other parts of the body also. But yeah, in today's conversation, AVN is one thing which can happen due to steroids.
Particularly, you mentioned that even if you're having it for like 2-3 days with heavy doses, can it really affect you for lifetime? Like just 2-3 days of having?
I wouldn't say that, but it can happen. It has been reported that heavy doses of steroids over a short span of time can also lead to avascular necrosis. Although people who are chronically on steroids are more predisposed to it. And there are some diseases where people have to take steroids essentially and they can't help it, like rheumatoid arthritis. It is a type of arthritis which can affect multiple joints, and these people are commonly put on steroids. But for them it is a necessity sometimes.
Okay.
So they can't help it. Because if they don't take steroids, then their joints are aching and paining and they're swollen and crooked.
Okay.
Yeah.
So something, as you were mentioning the symptoms of how, what happens when you have this disease. Before that, I also want to understand, when you mentioned avascular necrosis, this is a joint problem with joints, and अगर body के किस part में हो रहा है और क्या common है, as a person who has been seeing a lot of patients, as you mentioned, also increasing nowadays. What age groups are coming and what particular problems that are very common?
So let me answer it in parts.
Yes.
So first I'll answer that, can AVN or avascular necrosis affect other joints besides the hip joint?
Okay.
So commonly the hip joint is the most common site where AVN happens.
Okay.
But in a particular subset of diseases, like there is a clotting disorder called sickle cell anemia. In such patients it can affect the shoulder joint, it can affect the ankle joint,
Okay.
but it's not that common. So if I have to tell you few causes, we have already discussed steroids, we have discussed alcohol,
Yes.
we have also discussed idiopathic, but it can also happen in patients with clotting disorders, like blood clotting disorders. Some people have a condition and sickle cell anemia is one of them, and it is particularly very common in central part of India, like
Okay.
Madhya Pradesh, Chhattisgarh, and some parts of Karnataka and Maharashtra. In these areas it's fairly common, and it can lead to clotting of the blood in the blood vessels, which leads to stoppage of the blood flow to a particular bone, part of the bone, and leads to necrosis. And other common reason is hip fractures, which can of course will affect only the fractured
Yes.
bone. So now it will be easy for me to answer whether it can affect other joints or not. So if it is because of fracture or trauma, then of course it will affect only that joint where you got the fracture.
Yes.
If it is because of let's say steroids or excessive alcohol intake, we have usually seen that it affects the hip joint only.
Okay.
And mostly patients have an effect on both the hip joints. One can be one can have little more advanced disease, and other can have little lesser disease. And people who are on steroids, they also usually have hip joint, but they can also experience shoulder joint and ankle joint involvement.
Why is it happening most commonly in hip joint?
That's a very interesting question. So there's no clear answer to it, but
Yeah.
I'll tell you why the patients of hip joint AVN are more common.
Yeah.
Probably the hip joint is a weight bearing joint.
Okay.
So we walk on it, we sit on it, and in India, for doing daily rituals like your prayer, or sometimes in functions in the family, you have to sit on the floor.
Yes.
So if there is a hip joint involvement, you will get to know and will start bothering you. It will lead to limping when you're walking.
Okay.
And if we talk about the shoulder joint, let's say I have shoulder pain, then I'm not walking on it.
Yeah.
And if I have some shoulder pain, I'll take some medication, it gets better. And even if AVN has been diagnosed, it's not very common to perform surgery for a shoulder AVN
Yeah.
or a humerus head AVN, because it's a non-weight bearing joint. So people usually present with hip pain problem because that affects their day-to-day life. But why it is happening more in hip joint? No clear answer for that. But we see a lot of hip AVN patients for the same reason.
I have so many doubts right now while I'm hearing this. One thing you mentioned, that this is more common in the central part of India. Why
Yes.
so?
That is probably this disease called sickle cell anemia.
Yeah.
And this is a disease which is genetic and it is transmitted through genes. So it is more common in that belt. People are carrying that gene which leads to sickle cell anemia. And then
Okay.
sickle cell anemia leads to avascular necrosis.
Okay.
So AVN due to sickle cell anemia is more common in the central part of India.
Okay.
But AVN is presently everywhere. I mean, and people are more aware of it also. They know that this is one disease which can affect the hip joint.
Okay. And you were mentioning that you get a lot of youngsters nowadays. One, is it, does this, particularly have an age group, or does it happen in youngsters, or it can happen in...
Well, it can happen at any age. because somebody has taken steroids, let's say after the age of 60, it can affect that person also. But we see it commonly in this age group because one, excessive alcohol intake is more common in this age group. As we see, alcohol is something which is very much acceptable. Like social drinking is not a taboo anymore, and also steroid intake for multiple reasons. I told you, bodybuilding. And then these are the people who have very active lifestyle, and they want to get rid of their pain at any cost. While somebody at the age of 65 and 70, especially in India, would accept, I have some hip pain, I can manage with it. They would rather not do the surgery. They would much rather sit at home and just manage household work.
Yeah.
In contrast to somebody who's a youngster who wants to go out and live his life, have a family, go out with friends. Yeah. So it's commonly seen between 20 to 50, but yeah, it can affect any age.
So
we have seen people, even kids, like age of 14, 15, for some fracture can happen at any age.
Yeah.
They can also have AVN, but like most common is 20 to 50.
So we are seeing it from 20 to 50. It can be later for the people who have not tried to diagnose or have not tried to cure it.
Yeah.
So we can see it in...
Yes. We have operated patients at the age of 62, 65, 68 also for AVN, yes.
Okay. You also mentioned that, particularly after COVID, we started seeing a lot of...
yes.
So any particular reason for that?
Well, COVID is a kind of an unsolved mystery even now.
Yes.
But having said that, let me kind of simplify it for you. One reason could be in COVID it was a hypercoagulable state. Now that's a very heavy word, but it just means that we saw a lot of people having their blood getting clotted easily.
Okay.
So the blood clotting was happening easily, or it was exaggerated in the system. We all have blood clotting mechanisms in our blood.
Yes.
But when it gets exaggerated because of any reason, then the chances of blood getting clotted in your veins or in your arteries is higher. So that is one reason, because of a particular disease it can happen, especially COVID. And the other reason was a lot of people, especially in the second wave of India, which was in April 2021, a lot of people were falling very sick.
Yeah.
And steroid was one of the medications which was helping the doctors in saving lives.
Okay.
So a lot of people were being given steroids. And at that time, there was not much clarity about also what combination works best for the patients. So when it comes to saving life, it takes priority over the rest of the things.
Okay.
So steroids were being used for very sick patients also, and sometimes not very sick patients also. And that can also be the reason why patients who had COVID and then took steroids landed up with avascular necrosis.
Something we feel that when you have to be alive, you will, take up any option.
Oh yeah.
Also, I think not even particularly this disease, but any treatment, if you are given steroids, you have a chance of getting AVN.
Yes.
So, I think there are a lot of medications also which has steroids present in them.
So, I would say when a doctor is recommending a medication, and if the steroid consumption is not in a very heavy dose, I'm not suggesting that everybody who's taking steroids for therapeutic reasons will also end up having an AVN, but the objective is to make people aware that steroid is one cause of it, and if you are not really in a situation where taking steroid is the only option,
yes,
it's better to avoid it.
Okay.
Yes.
Want to understand a little more? You were telling about these causes and symptoms particularly. Want to understand a little about more symptoms, as in if a person who's going through a normal life, what kind of symptoms, what kind of problems that he or she will be facing, to have an idea of I might have AVN, or let's just go for a diagnosis from the right expert.
Correct. So let me simplify the symptoms first. Now there are three very common symptoms, and the most common is groin pain. If a person is experiencing pain in the groin, he and for no obvious reason, like people sometimes let's say, go on a trek or a trip, or let's say for that matter, Vaishno Devi trip, and they come back and they have soreness all over their body, that is different.
Okay.
But if you're just going on with your daily life and suddenly you experience groin pain, especially when you get up from the chair, get out of the car, this could be one very, very important pointer that it should be investigated.
Okay.
The other common cause of groin pain is hip flexor muscles pain, which is very, very common otherwise, like hip flexor pain. People come with hip flexor pain to us. Hip
Yes.
flexor is a muscle in the front of the hip, and sometimes it gets inflamed. But if you have groin pain, you must see a doctor who treats hip problems.
Okay.
Sometimes I have seen patients going to their nearby doctors
General physician.
family physicians who are not really orthopedic doctors, but at the same time, I'm not saying they're not good doctors. I'm saying their index of suspicion is low.
Yes.
If a patient comes to me with groin pain, I want to first of all rule out AVN.
Okay.
Why? Because if a patient is diagnosed in an early stage, then the hip can be salvaged, can be preserved. And I may prevent a surgery for a particular patient.
Okay.
So the one most common site of or symptom is groin pain, but a lot of people come with buttock pain also.
Okay.
It all depends in the femur head where exactly the bone is becoming dead.
Okay.
If more bone is dead in the front, then you have groin pain. If more bone is dead in the back side, you have buttock pain. And sometimes patients come with knee pain.
Okay.
The hip pain can get referred to the knee, and people are seeing doctors for knee pain. When we examine these patients, we figure out like hip knee is normal, then there is probably something happening in the hip, and then we investigate and figure out if it is AVN. So these three are very, very common: groin pain, buttock pain, and knee pain, which is a referred pain.
Now, something I want to understand, you mentioned somewhere in between that, yes, if you're sitting, you're not sitting on the chair, you're sitting down. A lot of times you have a lot of rituals where we have to bend. Just trying to frame that question particularly that in general life, particularly, in a lot of areas in our cultures, we are told, I think, जब बचपन से हमें बताया जाता है कि नहीं, why are you sitting on the chair? You are young, you should sit down, you should be healthy, you should cross your legs and sit.
Yes.
Is it safe to sit, down on the floor and, bending yourself? And I'm asking it, of course, I have an expert sitting in front of me. I know that, in general, yes, you are healthy, you should sit down, you shouldn't be sitting on the chair. But is it, any point, is it true that, sitting down is not going to be healthy or
not really,
like that?
no. So the simple answer to your question is, of course, you can sit on the floor, you can squat, and you can sit cross-legged. And I think pain should not be a part of anybody's routine. So if you are pain-free in doing these movements, irrespective of your age, you can do that. It's not going to affect your hip joint or knee joint. But if you get pain in doing that, then it must be investigated at the earliest.
Okay.
And you should, in general, I tell my patients, stop doing those activities which increase your pain or which lead to pain.
Okay.
And go see a specialist and figure out why it is happening. In majority of the patients, it is just weakness of the cartilage. As you mentioned, a lot of youngsters also get knee pain, and it is because of the soft, weak cartilage, and we give medications for cartilage strengthening and they are back to their normal lives.
Okay.
So sitting on the floor is definitely, it's absolutely okay. But if you have some issues, then definitely not okay. You should see a doctor.
I'll go back to the causes, and we did discuss about bodybuilding, gym and steroids, one being a very common reason. You also mentioned alcohol is something I would want कि थोड़ा सा अगर हम उसको, because nowadays, as you also mentioned, that drinking and having alcohol is so normal that it's not anymore a taboo. It's like, oh, well, you're out. But nowadays, not drinking is a taboo. If you'll go to a party and you'll say, oh, I don't drink, people will be like, oh, really? Is
People do ask why you don't drink.
It's like, are you healthy? Why can't you? So, one that, and are there any other causes which youngsters, or anything that youngsters might be doing wrong in their daily life which can cause AVN?
Not really. There are other causes, of course. As I mentioned, fractures around the hip joint can, especially neck femur fracture. It's a particular fracture. If which is the most common fracture leading to avascular necrosis. Others I mentioned clotting disorders, so not particularly anything in the lifestyle besides what we have discussed.
Yes.
And alcohol is something which I would want to emphasize upon, because alcohol is not only leading to avascular necrosis if consumed in heavy amount, if you consume poor quality, low grade alcohol, and if you people who are addicted to it, of course, they would end up having avascular necrosis, most of them. You would be surprised that there are certain subset of patients whom I know who come with their friends who have AVN. But they say, Doc, I've been consuming as much alcohol as him, but I don't have AVN. So probably there is some element that not everybody who consumes excessive alcohol gets AVN. But for the larger public, I think alcohol is one very common cause of AVN, and not only AVN, it also leads to weakness of bones.
Okay.
So we also say that alcohol and smoking are two most common preventable causes of weak bones.
Okay.
So now what our lifestyle is, we are largely indoors, so sunlight exposure is less, and even if you are outside, we tend to keep ourselves well covered, or you're in a car, or the sunlight exposure is relatively less. So that also leads to weak bones. At the same time, alcohol, smoking, they are documented two most common preventable causes of weak bones. So I mean, I would want the youngsters to know about it. It's not only AVN.
Yeah.
Everybody may not get AVN,
Yes.
but if you are into excessive alcohol, your bones will definitely become weak, and that will bother you as you kind of advance in the
Also
age.
smoking.
Of course.
Going ahead, want to also understand if you, at some point, during the conversation you were mentioning that if a person has AVN, they might be limping a little or being crooked a little. And when even if as a person who, sitting here on the chair and imagining the information that you're giving, it's very difficult to process कि एक बच्चा जो शायद 13-14 साल का है या 20 साल का है या 25 साल का है and starts having the symptoms and is going to hamper his or her daily life.
Yes, correct.
What are other things that you're going to see, how you can diagnose it yourself, so it's a very early detection?
So yeah, I agree, because we as doctors not only see the patient's physical challenges, we also kind of experience the emotional challenges which a patient has and the family has.
Yes.
For a moment, if we imagine that a 23-year-old who was an athlete, let's say, and forget about doing athletics, he's struggling to even walk.
Yeah.
I remember treating a 21-year-old who came all the way from Hyderabad,
Okay.
and he was in Indian Army and he was about to finish his training.
Okay.
And then his father calls me from Hyderabad discussing about AVN, that he has been diagnosed with AVN, and it was a very
Disheartening.
yes,
I think.
disheartening kind of a situation, because at one point you are waiting for your son to finish his
Yeah.
graduation, and then on the other hand you are just wondering, oh God, will he be able to continue in Indian Army? And this gentleman is also from Indian Army. So they had detailed discussion, and when they came to my clinic and when we had a discussion about it, I've seen so many parents, going into tears to see their children.
I'm having goosebumps right now. I'm just thinking of your child. At one point you want to see him or her as a soldier, and at another point you're being worried that he or she be able to walk.
Correct. So it's for us also sometimes it gets very, very heavy emotionally, and so the best thing we can do for them is to treat them with the best possible treatment. Having said that, as I mentioned, self-diagnosis is something you can have an index of suspicion, you cannot diagnose, but there are certain things like groin pain, buttock pain, knee pain,
Yes.
without any cause, without any injury, and suddenly they are in part of your daily routine. So that should raise a suspicion. And I would urge people to go and see a hip and knee specialist, or a experienced orthopedic surgeon, or somebody who can guide them well. Because at an early stage, we as doctors also start with an index of suspicion and then send them for a particular investigation. In many patients in early stage, the x-rays come out to be normal. But if a patient has these symptoms which are consistent, we will send them for an investigation called MRI or magnetic resonance imaging, which is so commonly available in probably all the major cities of our country. And MRI is the gold standard investigation which will pick avascular necrosis of hip joint at a very early stage. And the earlier you come, the better it is for you.
Yeah.
And the better it is for us to treat you. The most common confusion people have is thinking it is not coming from the hip joint, rather it is sciatica.
Okay.
If you have buttock pain, people think मेरा nerve press हो गया back में, sciatic nerve press हो गया and I'm having sciatica.
Yeah.
And they continue to get treatment for it for months together. When finally one day they decide, okay, ये sciatica अगर होता तो अभी तो ठीक होना चाहिए था. There's no improvement at all. And that's when they go for a second or a third opinion and they come to know, oh God, I have AVN, which has advanced now. But probably 6 months back it was in early stage.
Yeah.
And the treatment could have been different. So I would urge everybody who is watching this podcast that you should go and see an orthopedic doctor who specializes in treating hip and knee problems.
The right expert.
Yes.
And the right information is important, because when you just mentioned, it might be sciatica pain. That's
Yes.
what you call it.
Yes.
I have heard, people saying that if there's a person who's born bleach, people say कि उससे लात मरवा लो, and we have all these treatments going around कि ठीक हो जाएगा, which actually can worsen the case.
Well, as far as alternative treatment options are concerned in our country, there are plenty, and of course we will not go into details of it. But yeah, I mean, I would rather say one should seek scientific treatment, and one should seek scientific treatment from an expert. Only then, you have the best chance of treating this particular disease or any disease for that matter in the best possible way.
Okay. Something quickly I want to throw a little light on is treatments. We have covered, what are the symptoms, how would the person feeling. I think something I understood during the discussion is that I'll also want you to include this point in treatment, that this is one aspect of this is physical, but when a person is going through these changes, there's also going to be a lot of mental and psychological stress.
Definitely. More than we can imagine, intangible.
Yes. So let's throw a little light on the treatments and how can you go about it.
So as far as AVN is concerned, as we call it, AVN in short, and a lot of patients also aware of this particular term. If we diagnose it in early stage, then we can treat the patients medically by giving medications, by giving a particular medicine which is called bisphosphonate and specifically alendronate. But yeah, I mean, this is not a consultation which I'm giving. I'm just trying to
conversation.
Yes,
create
create awareness. Of course, these medications should be taken with doctor's prescription. But yeah, in early stages, it is possible to treat with medications without any surgery, and there is a very high success rate of that, provided you reach the doctor in an early stage.
Yeah.
But if you let's say if this is a progressive disease by nature, let's say you land up little late, and you're somewhere in between. So there are two schools of thought on that. A particular group of doctors would treat you with a surgery which is called core decompression, and stem cell therapy along with it, which is still, I would say, is not a gold standard, and it's not successful with every patient, and the success rate is at best between 50 to 70%, which means if 100 patients do this particular surgery, only 50% may get benefit and 50% may not.
Okay.
So that's one aspect of it. Or patients who are not not in serious pain and who want to consider non-operative treatment options. In my hands, I would rather treat them medically, and people do respond to it in stage 2 and early stage 3 of AVN. So AVN has 4 stages. There are multiple staging systems, but the most commonly used system, Fickert-Arlett systems, gives gives 4 stages. So stage 1 people definitely can be treated with medications. Stage 2, early stage 2 can also be treated with medications. Now when you are in stage 2 and stage 3, early stage 3, that's where people start talking about doing a hip preservation surgery, which is called core decompression.
Yeah.
And as I just told you, it is yet not the gold standard. We need to go understand more about it, and there's a relatively higher failure rate than acceptable.
Okay.
Then there's also one very important point I would like to mention. When we are treating patients non-operatively, those patients where the reason of the AVN has been eliminated from the lifestyle of a patient. Let's say you were taking a lot of alcohol and you've stopped taking it.
Yeah.
Let's say you were consuming steroids, now you've stopped taking it. They have higher chance of getting success with non-operative treatment because the particular offender which led to AVN has been removed.
Okay.
So that's something very interesting, and I would like people to know about it. At the same time, those people who choose core decompression as their treatment, they should discuss their success rate and the probability and what kind of lifestyle would they have, what kind of bed rest they would be required to do after the surgery in detail before they take their decision. Now that brings me to stage 4 or advanced avascular necrosis, or stage 3, stage 3, which is going into stage 4, advanced stage 3. These people have their hip joint is already damaged. The ball of the hip joint is already crumbled, and it is not spherical anymore. It is not round anymore. It is flattened or sometimes mushroom shaped, and they have shortening in the leg. They have limping. They have pain, and that's what affects their self-image so badly that they get some of them get socially withdrawn. They would not want to go to social gatherings because उनको लगता है कि मैं लंगड़ा के चल रहा हूँ और मैं slow चल रहा हूँ, and everybody would ask me क्या हुआ, and if there are stairs, what would I do? If there's no lift, what would I do? If we need to sit on the floor, what would I do? And multiple such things which really dents their self-image, and they are socially withdrawn. They are sometimes in depression, and sometimes they feel life is ending for them, and not only the patient but also the family sometimes. And see, nobody wants to undergo the knife, nobody wants to undergo a surgery, but in advanced stages that is the treatment option, and which is a life-changing treatment option for these people. And I am talking about a total hip replacement surgery here. So patients in advanced stages would immensely benefit by total hip replacement surgery if it is performed well, using the best implants, using the best surgical technique, equalizing both the legs, balancing your hip in a way, the way it was before the surgery. So a lot of ifs and buts have come into it, but this is one gold standard treatment for advanced stages of avascular necrosis.
Discussing all of this, I think one thing I understood is that getting sick and going into the later stages of diseases is, with a lot of these insights and informations from the experts, every time I think I am just coming to a conclusion that 1, you need the right expert. 2, if you're getting sick, it's not only physical, it's going to take a lot of mental and psychological toll on your health, which is something I think we need to take care of.
Yes, absolutely.
A person who, from a healthy lifestyle, if he or she starts limping or is not able to walk, will take a lot from their personal and professional life.
That's correct. That's correct. I would like to say to all the youngsters, or not that young, middle-aged people, or people who are still into very, very active lifestyle, that if you have AVN, do one favor to yourself. At least do not fall prey to non-scientific treatments. If you do that, you not only waste that golden period where there is a possibility to treat you without doing a surgery, rather than that, you also end up wasting a lot of precious time. You end up wasting a lot of money, and you get nothing out of it. So your disease and the stage of the disease decides what treatment should be given to you. Consider this. If you have a heart problem, if somebody has a heart problem, if an artery is blocked, then scientifically putting a stent into that blocked artery is something which is going to save you from a heart attack and give you a normal functioning heart.
Yeah.
In the same fashion, in AVN, if the blood flow to the bone is blocked and it is dead and it is crumbled, has changed its shape, then total hip replacement surgery can give you your normal life back. It can turn your pain into power. You can, with modern hip replacement surgical techniques and modern US FDA approved implants, majority of the AVN patients are able to sit on the floor, sit cross-legged, squat, and also do a lot of activities which a youngster would want to do. And of course, walking normally without limp, all these things are non-negotiable. They will be there any which way. So rather than thinking that my lifestyle would change after the surgery if I lose my natural hip joint, well, your lifestyle will definitely change, but it will change for good. So meet an expert, discuss your treatment options, whether surgical, non-surgical, and treat yourself scientifically.
With this much of information, tips, pointers, insights and knowledge right from the experts, we have Dr. Pankaj Walecha with us. All I can say after this conversation is please go to the right experts if you are facing any issue with your physical health, with your health in total. Please consult to the right person, and we will keep coming back to you. We will keep getting lots of new information for you from the experts, from the doctors who are dealing with all these health issues on everyday basis. They are seeing these cases, they are solving them, talking to the patients, also understanding what different people are going through. Please, just one advice. I think while I was having these conversations, I just understand that how important it is to talk, to tell, and having just a small conversation of what you're facing, even if it is the smallest issue with your health. So please do that, and please take care of yourself, and we'll keep coming back with the new episode. I'll see you in the next one. Please take care and have a great day. Namaste.